Good afternoon. I'll take my glasses off. So thank you very much. Hopefully you'll sort of understand the position I'm in really, and that some of you might be thinking, thank God it's not me in your position. Just hold that thought. So if I do stumble over some slides, just hold that and you can empathise with me. Okay, so what's the case study about, the case presentation about? I'd really like to tell you about CueFire, which is our XenZone's online counselling support platform. Particularly to tell you about our model, our service delivery, and really to focus on three core elements really, around reducing stigma, increasing access and improving outcomes. A little bit about XenZone. Okay, what's XenZone's purpose? Well, essentially, XenZone as a company, our aim is very simple. It's to make it easy and safe for all generations to access the best emotional and mental health services as and when they need them. And I think that's really crucial, I think, because we're talking about accessibility. And we've heard this morning about the tendency to pathologise, and I think sometimes there has to be a problem before young people can access services. And I know people within the room will be very much aware of the value and the work you do on a day-to-day basis. I'm sure for a majority of you is, okay, how can we increase access and provide that early level of support? Well, that's what we do really, and that's what CueFire does essentially. So how do we do that? We do that through tech. So we're a tech company, but we're more than a tech company. Our roots are also in providing an effective and robust service delivery model around supporting young people. Just a few stats, essentially. Our CueFire platform, as it currently stands, a young person logs in every 90 seconds. That's during the waking hours, not during the middle of the night. And also we are currently contracted to deliver to 46 local authorities and CCG areas. The actual total number of CCGs, we're covering about a third of all the CCGs in the UK at the moment, because some of those contracts are with multiple CCGs. So we've been up and running since 2004 as CueFire. We've iteratively developed our service over that time, and we're now in a position really where we can begin to report very, very comfortably on how we're helping to help young people access support and advice, and if they want it, counselling, and also just to generally raise awareness of the value and begin to prove the value of a digital offer to support the services that are available. Just a map to prove where we are at the moment. So this actually is a little bit out of date. The shaded areas are where we are delivering CueFire currently at the moment, where we are commissioned. But actually that's up until end of April this year. There are some new additions to that area. We can shade Kent now. We've just recently been commissioned to provide CueFire under the Head Start programme. And hot off the press, you can also shade in Essex as well, where we've just been asked to provide CueFire to the 7 CCG areas in Essex, and we're mobilising currently. Okay, that's where we are. There's a young person. There's a young person there. So digital is at the heart of what we do. Why? Because young people are digital natives. That's why we know digital has a really, really important role to play in supporting young people. We have a deep-rooted philosophy around co-production. Our site, the development, the look, the feel of our site has been informed through the views and thoughts of young people and the contribution. And in the day-to-day running of our service, the content and the way that the themes and the content feed is influenced by our young people. Young people participate in the content that goes onto our particular site. So, yeah, that's the value of digital. We know young people are digital natives. I must stress at this point that we would not be as successful as we have been, and I don't think we would have seen the movement of young people using our CueFire site if we didn't work collectively and proactively with local providers. Digital would not work on its own. We have to blend, to use that word, with other services as well. So we make that a big part of our CueFire offer. We simply work where we are commissioned. We work with all local providers, be they the voluntary sector, be they existing universal and targeted services, but also very closely with our secondary care colleagues in those particular areas, really to ensure robust and seamless pathways. So that's That's core to what we do. That's what our site looks like. There you have it. Young people very simply are able to sign up and log into CueFire. They can access, the site itself is 24/7, 365 days a year. So there's 24/7 self-help material on the site, so it's a multi-channel platform. Self-help's a big feature. Peer-to-peer, but moderated support is a key feature. That allows young people to communicate with each other, use particular issues and themes which are relevant and important at that time. Our back-end team are very, very proactive and obviously for obvious reasons moderate all content, so there is no direct peer-to-peer support. And that's a really valuable approach, I think, to help improving accessibility. That's the feedback we get. They can talk to each other through a moderated platform. So that's something we have, is core to our delivery. In terms of accessing counselling support, that is also available. Our availability for counselling, as you can see there, runs from 12 p.m. 12 midday to 10 p.m. at night. Weekends, it's 6 to 10. So that allows a young person to drop in for a chat with our BACP accredited counsellors. And obviously it's short for time now, but I can certainly let you know more about our clinical team in the break, but I'll touch on it a little bit more at this point. So our young people are able to drop in to access our counselling team. Very simply, if a young person chooses to do that, they would be offered a baseline triage assessment. We use YP Core as one of our measures to measure need and well-being. And essentially, that allows a conversation and a discourse to continue. So that's a primary aim and a primary route for young people to seek early intervention or get advice or get support through our counselling service. A bit more about what it looks like. So young people can also use it, they can also access CueFire smartphones. We've recently invested in allowing our platform to be far more compatible and smartphone savvy. We are seeing an increase in use of our service through that. So again, it's of how to improve accessibility or give it to them on their fingertips. So that's really, really helping. Another young person. Always like these quotes, so just have a read of that, really. So the value of tech in allowing choice around how young people access mental health services. Tech isn't for everybody, as indeed face-to-face isn't for everybody. So it goes back to that blend. It's really, really important we give young people that choice, and that's a principle we hold really, really dear at XenZone and also in terms of how our CueFire platform is developed. A few stats. I think I'd just sort of probably highlight the number of logins, really. So this is over a year. This is again about how young people access advice and support. So by logging into CueFire, so we've got just over 230,000 logins in 1 year to CueFire. New registration, so whenever we go to a new area, we invite young people to sign up and register. So again, in the last year, just a tad over 40,000 new registrations. So young people curious, wanted to suss out and maybe even use CueFire. Stigma, the other area, so it's about reducing stigma. And again, a quote from one of our young people. So CueFire has really helped me. It's given me relief when I've had nobody else to turn to. Thanks so much for talking to me. So that's within the context of really perhaps not being able to find the way, or maybe feeling sort of stigmatised by not being able to access support or even ask for help. How do we do that? I think, again, the tech offer provides that choice. So you don't have to speak to a person about that. The other thing just to sort of highlight, and I think it's crucial to understanding CueFire, is that young people at the point of entry sign up anonymously. So there's no patient identifiable data, to use health terms. Now, I come from the health, my background is within the health service. I left as a psychiatric nurse. I left probably about 7 or 8 years ago. Everything was around patient identifiable data. This is a real shift. Anonymity is great. It's clinically managed very robustly by our very experienced and dedicated clinical governance team. We have a clinical director who manages the obvious questions around safeguarding, and if we have time, I'm sure one of you might want to ask that question afterwards. But we certainly make sure that any young people who then present with a level of risk are able to, we work with them to sort of highlight the risk that we are concerned about, and also to be able to think about how they can give us consent to give them their name so that we can link them into the existing pathways that we establish within each particular contracted area. So reducing stigma. Very simply, young people find the online environment safe and feel less exposed. And that's from that specific report, Manchester University, comparing online and face-to-face student counselling. So have a read of that. I think that helps you sort of set the context of online and face-to-face. I'm now going to talk about Thrive. Who's familiar with Thrive in the room? Scattering of people. A lot of noise, a lot of buzz around Thrive at the moment. So I guess in terms of children and young people's emotional health and well-being, thankfully we're moving away from that ridiculous tiered model, and we're now looking at something that actually young people, the majority of young people thrive, but they have various levels of needs which can peak and reduce at specific times. So I just really wanted to make the point that the CueFire model mirrors perfectly the Thrive model, in that the various functions on the site allow a young person to get advice if they need it, through some self-help forums or through some self-help material, or if they want to access more help, get more help, they can tap into our counselling service. We inevitably work with young people who require more help, and we do work with young people with very complex needs, but that's where it's important that we do then integrate with our partners in local areas to make sure that the pathways are clear, the support is right. As a service, we're not necessarily the lead at that point, but we would work to support existing work that's being delivered, or maybe work that's needed, and the support that's needed for that particular young person. So what's the digital advantage? Instant professional support for children and young people whenever they need it. Reduce waiting times for CAM services. Reduce waiting lists, potentially. Reduce pressure on GPs and A&E departments and hospitals, and reduce pressure on specialist services. That's not rocket science, that's what a good early intervention model should do. The key points I've mentioned, it's integrated and it offers choice. And it's crucial, tech is crucial as part of an early intervention service. Future in mind, very clear, we need to make better use of the voluntary and digital services to fill the gaps in a fragmented system. We've spoken a lot about that this morning. Online counselling has the potential to provide an important support system for issues that might otherwise remain unexplored. I think that again states the obvious. It's that choice element, it increases access. Okay, how good are we? What are our outcomes? And I think that's something we are developing significantly over the years of the iterative developments of CueFire over the time. So how do we measure outcomes? As part of a core triage, as it were, if a young person chooses to drop in to use CueFire, our counsellors would use YP Core. Really, that allows a conversation to take place, and it also allows us to screen need. And also part of the risk assessment process as well. We don't report a YP Core, but we use that as an initial assessment tool. We're a goal-based outcome service. I think like a lot of universal and targeted services, we really value and work with what young people want to work with. Their goals are crucial. We work with the goals that they particularly want. So we have developed our own specific measure, really, which is called the Counselling Goal Systems, or COGS for short. It's very simply a distance measure tool, distance travelled tool. Goals are created by the young people, very much supported by the counsellor, and regularly updated on a scale of 1 to 10. And we work with those goals throughout their therapeutic journey with CueFire. And just also the recent development, whereas before we were setting goals within the context of chat, our live text chat messaging, we've now shifted that young people can set goals outside of chat. So if they're accessing the site for some self-help materials, or maybe they're participating in forums with other young people, they can set goals around some of the content that they're exploring and they're wishing to work on there. So it's a way of taking that distance travelled outside of a one-to-one intervention. We also use end-of-session questionnaires, simply follows the CYPI requirement for capturing really the therapeutic alliance. And I'll come on and I'll show you a slide about that in a second. We also have evaluation questionnaires as well to say, can you give us some feedback on what you think about the site? So we also give the young people the opportunity to comment and rate us on that particular level. And just an aside that we do our own sort of friends and family test, really. Would you recommend to a friend? And the majority of our contracts, it's around about 90 to 95% of young people would recommend. A little bit about goals achieved. So as I explained, essentially, young people set a goal and it's on a rating scale of 1 to 10. I just really want to highlight that over the period of CueFire's life, young people have set around about 5,000 goals over that time. And in the majority of cases, as you can see, 52% fully achieve the goals that they have set out to achieve. So essentially, just over 2,000 young people have fully achieved the goals that they wish to achieve. I think this is a useful guide, really. And again, I think it just highlights what young people might want from mental health support, emotional wellbeing support. Manchester Uni helped us code the types of goals that young people set themselves, really. And I think just to sort of look at that particular graphic there, really. 1 to 3, it's really about getting help. The majority of young people who access CueFire actually just want to get help. And how can they seek help? How can they get advice? So those are the top 3 in terms of goals set by young people. So that's really interesting about where do we invest? What do we think about in terms of should we be focusing at the sharp end, the complex needs end? There's an argument for that, of course there is, but equally I think we're saying that potentially, and I think what our evidence is beginning to show, is that it is definitely worth investing at the early intervention end, simply because a lot of young people have set goals about all I really wanted was to, how do I get into a service, how do I understand how I feel, and how can I sort of find my own support and my own self-help and my own guidance around that. And the next area is more about sort of obviously tapping into more specific therapeutic support. So those are the most common types of goals that young people highlight on CueFire. A little bit there about this is the graphic in the middle is what young people see after they finish the chat session. They're asked to rate how it went, and those are the therapeutic alliance questions and the measures that we regularly report to our commissioners. And as you can see, we're pleased to report that in all of the cases, we're looking at certainly over 75% see the rate as highly in terms of feeling understood, and also talking about what was important to them, was the service a good fit for them, and was it right for me? So we report on those regularly. Final point, really, here is we know it's a good model for young people. Young people have bought into it. The volume of young people have bought into a digital model to ask for help and to seek early support. But what's the impact on the system? And we've sort of highlighted that here, really, that there is some evidence that we're certainly from our commission in Bracknell Forest, that since the introduction of CueFire, there's been a 7% reduction in referrals to specialist child and adolescent mental health services. Biggie in Lincolnshire, we were very much integrated with the primary mental health service, and there was a significant reduction in inappropriate referrals to specialist CAMs from 35% to 2%. That's very much working with a local partner. A lot of commissioners say, actually, what we're seeing is a lot less noise in the system. It's less buzzy. I think people are clearer about the pathways. But this is where there's a lot of work to be done, really. And I think we certainly at XenZone, we're desperate to work with commissioners, secondary care providers to really focus on the impact upon secondary care and the impact upon, I guess, the longer term outcomes for young people. So that's a plea, really, to say, look, we've started, but we would really like to work more and sort of drill into that a little bit more. And in fact, we've been working with the Education Policy Institute around outcomes and impact, and their report is due to be published at the end of October. So you're more than welcome to download that paper. There's a link on our website to do so. So in a nutshell, that's CueFire. A few more comments. And I'll leave you with that. Thank you very much.